I am standing here in Limsa, Barakot municipality, which was one of the worst affected areas of the earthquake, which happened in early November in the western part of Nepal. Behind me is the basic primary care hospital of Barakot municipality, which was completely damaged during this earthquake. Several other facilities have been damaged within Jajarkot, a dozen of them severely damaged, which needs a setup where patients can access essential health services. Identifying this need, WHO has established a 12-bedded facility using the medical camp kit, which has been installed today and handed over to the municipality. It will provide inpatient and outpatient services and also maternity services, so that we continue to ensure that essential health services are provided, including psychosocial counsel and mental health services. This medical camp kit is similar to what post 2015 earthquake WHO had provided to ensure urgent health needs of the populations are met with. WHO from day one has been working with the government of Karnali province and the federal government in terms of ensuring that there is good health coordination among the health partners, that we initiated support for disease surveillance, for ensuring that essential health services are provided, including psychosocial counseling and mental health services. WHO will continue to work with the government of Nepal to ensure the health needs of the people of this municipality which are affected by the earthquake are met, and this has been possible due to continued support from our international donors and partners.